Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Thank you much, Deborah. It's always a pleasure and an honor to be able to talk to the public here because I consider one of our missions here at Washington Hospital to educate and teach, because it's only by teaching that we can understand the diseases that will affect us and hopefully thereby alter the course. Today I'm going to be talking about heart failure and living with heart failure. Our objective are, first of all, I want to have you learn what the term heart failure means. Then we're going to talk about the common causes of heart failure. Now, there are many causes of heart failure, but I'm going to address predominantly the most common causes of heart failure. We'll talk a bit about the symptoms which are caused by heart failure, and then we'll briefly address the different treatments which are available for heart failure. Now, what does heart failure mean? Heart failure is an ominous sounding term. It sounds like things have just stopped. But that's not truly the case. What heart failure actually means is that the heart does not pump as well as it should. The heart is not working at full efficiency. It's not operating on all 8 cylinders. And that's different for different people. If you took my heart and put it into an Olympic athlete, my heart would surely fail if it was called on to do the demands that the athlete was required, because it's not trained as an Olympic athlete. Yet my heart is able to adequately do the job that it needs for me to have it do. So heart failure is basically where the heart is not doing as much as it should, and thus it causes limitations in how well the body functions. Now, heart failure means that the heart has been damaged or weakened in some way, and there are many ways that that can happen. And the decreased function of the heart causes symptoms, and we'll go in to some of the symptoms which are evolve with heart failure. So the bottom line is, when we talk about heart failure, it's that the heart is not really doing its job well. So what do we talk about with what is the job of the heart? Basically, the job of the heart is twofold. One, it pumps blood through and out of the lungs. Through and out of the lungs, and thereby makes oxygen-rich blood available. The second job of the heart is to pump that oxygen-rich blood to the rest of the body, thereby nourishing the organs and tissues of the body. Now, this is February, and we're getting close to Valentine's Day, and I'd be remiss if I didn't talk with you about the most important job of the heart. The greatest job of the heart is love. That's the most important thing. And that's still important to a cardiologist as well. So this picture tells you about the circulation of the heart, and I hope you'll be able to follow me if I can get my cursor here. This has the heart in the center here. On the right side is the right lung. On the left side is the left lung. At the top or the head is the circulation to the head and arms, and the bottom is the circulation to the trunk and legs. Well, the right side of the heart receives blood from the head and arms and the trunk and legs and takes that and pumps it through the right heart out into the lungs. Both sides, part to the left, part to the right, and then that oxygen-rich blood. In the lungs, the blood is oxygenated. It's exposed to the air within the lungs, and the oxygen is then transferred into the blood. And that's symbolized by the change in color from blue into red or pink here to indicate that the oxygen-rich blood is now returning to the heart here from the right side right lung, and here again from the left side. And that goes into the left side of the heart. And that is when we talk about heart failure, that's the most common place where the heart doesn't work well, and that's on the left side, because the left side of the heart has the job of pumping that oxygen-rich blood out. You can see here it goes up to the head and arms, and out down into the trunk and legs. And it does that up against the blood pressure, which is maintained in the arteries, which are here in pink. So this is the circulation. The blood comes back from the tissues, gets pumped through the right heart, out to the lungs. Blood gets oxygenated, returns to the heart, and then gets pumped out to the tissues again. And that's why we call it the circulation. It's just one big circle. That's why we call it circulation. So let's talk a bit about the causes of heart failure. One of the most common causes of heart failure is a weakened heart muscle, a heart muscle which is damaged. And it's damaged usually by heart attacks or by narrowed arteries, where the heart is not getting the nourishment it needs because the arteries which feed it have become blocked. A second cause of heart failure, which is now more recently recognized, is what we would call stiff heart muscle. This is usually caused by long-standing high blood pressure, where the heart, instead of being nice and flexible and strong, the heart muscle becomes thickened and stiff, usually as a result of high blood pressure. Both of these can cause dysfunction of the heart, although they often manifest itself in different ways. The third common cause of heart failure are leaky or narrowed valves of the heart. And we'll talk a bit more about each of these causes in a minute. But I first want to talk about heart attacks, because they are probably the most common cause of serious heart failure. So what is a heart attack? A heart attack is when blood flow through one of the coronary arteries becomes blocked. And this usually occurs where the arteries have been narrowed, usually narrowed as the result of buildup of plaque and cholesterol. So let's take a look at the arteries which feed the heart. On this slide here, we've got the left side of the heart here. And that is fed by the left coronary artery, left anterior descending, coming here in red, and also around the backside. And on the right side of the heart is fed by the right coronary artery. So these arteries are on the surface of the heart, and they feed nourished, oxygen-rich blood to the heart muscle so the heart can work well. Well, a heart attack occurs when one of these arteries becomes seriously blocked or completely blocked. So how does a heart attack happen? A heart attack is where one of those arteries becomes blocked, usually by the buildup of a blood clot. And thereafter, the blood flow to that part of the heart muscle is cut off, and the heart attack starts. If that blockage is not opened up, then the part of the heart which was fed by that artery begins to die. And the damage by a heart attack is what causes the heart failure. Here's an example. Here's an artery here, and in this artery we've got plaque which is built up inside the artery, and then on top of that a blood clot forms. Now if that's happening down here in the bottom picture here, right at this little circle, the rest of the heart fed by that artery down here at the bottom is then damaged, and you can see the damage showing up in this dark blue or purple area here. So that's where a heart attack causes damage to the heart muscle downstream from the blockage, because the flow is completely interrupted. This slide shows a bit of what happens with a heart attack, just so you can understand. Here you've got a buildup of plaque, you've got blood flowing by, and then a little rupture occurs in that plaque, and a clot starts to form. And you can see in this area here, the clot starting to enlarge. It's starting to restrict the flow of blood downstream. And if the clot further enlarges, as you'll see it happen in just a second, it will then completely block the artery. There it goes. And now the artery is completely blocked and flow is stopped. And so thus downstream, a heart attack would occur, and the damage to the heart muscle downstream would occur. So this is probably our most common and serious cause of heart failure is damage from heart attacks. Now what we do at Washington Hospital is when somebody's having a heart attack, we get in there and open up that artery. And the way we do that is with angioplasty. That opens the artery and we restore blood flow using balloons and stents. Rapid treatment is essential. We like to have this done within 1 hour after symptom starts. If we're quick at getting this done, heart muscle can be saved. And if you save the heart muscle, then you're not going to end up with a heart failure. So that's very important, is getting rapid treatment for heart attacks. Now what is a balloon and a stent? Basically we go into the artery, we put in a catheter which has a balloon on it. We open up that balloon, we inflate the balloon, and on the outside of the balloon is a mesh. It looks almost like a roll of chicken wire, which we inflate to hold the artery open. So this is a diagram of the stent left in place holding that artery open. Now this slide gives you some idea of how large a stent is. It's actually fairly small, usually on the order of 2.5 to 4 millimeters in diameter. And here you have a dime next to it to show you the relative size. So even though this is a small artery, it's very important because it feeds the heart muscle, and when the heart muscle is damaged, then heart failure can occur. So here's a little movie picture of the stent being deployed. Here you've got the plaque in the middle of the artery. The balloon is opened up. The stent is deployed out against the wall, and then full flow is restored. Now I'll play this one more time so you can see it again. Balloon down, balloon up, stent deployed, and then the balloon is withdrawn, leaving the stent in place. So this is one way we treat heart attacks here at Washington Hospital, and the importance is that we get the artery open quickly so that no heart muscle is damaged. Now here's a picture of what it actually looks like inside an individual, and one way we diagnose disease of the arteries is to do what's called an angiogram. Angiogram, angio meaning blood vessel, gram meaning picture, angiogram. So we're actually taking pictures of the blood vessel. In this movie that you'll see, there's a catheter which comes down from above, and you see here there's a little marker right at this area here which marks the tip of the catheter. And then through this catheter we inject into the arteries contrast material which then shows up. And so I'm going to play this now. And you'll see that now with the injection of contrast we can see the arteries here in real time just moving back and forth. We'll play this again so you can get a good idea of what we're doing as cardiologists when we assess somebody with coronary disease for blockages in the arteries. So you can see in some parts of the arteries there's areas of narrowing down in here. There's also an area of narrowing up in here. Now, if you look really carefully here, it may not be easy to see if the lights are up. You can see a little mesh-like network in this area, and that is actually a stent which was previously placed in this artery to hold that artery open. And you can see, as I play it again, that the blood flows through that area where the stent was down into the downstream areas of the heart. So the two ways that blocked arteries can cause problems with the heart muscle. One is if there is a heart attack and the heart muscle dies. The second is if there are severe narrowings in the arteries, then the heart muscle is chronically undernourished. It just doesn't get enough blood flow, and thereby it becomes weakened and does not pump as well. Now that's a situation where opening up an artery can actually improve heart failure. I'm going to show you another angiogram. This one is a little bit more normal, but it does have a, so you can see the catheter. Catheter, we start from the groin, bring it up and around into the arteries of the heart. Here's the end of the catheter right up in this area, and we're injecting into the arteries, and you can see the nice outline of the arteries. In this part of the heart there's actually what we call a dissection, where the artery has actually gotten disrupted and torn up a bit. And with that, there can be poor flow downstream and lack of good function in that part of the heart. So blocked arteries, either heart attacks or severe narrowings, can cause damage and weakness of the heart muscle. The second major cause of congestive heart failure or heart failure is actually this stiff heart muscle, stiff heart muscle. The medical term for this is what we call diastolic dysfunction. And this is only something which we've realized more recently is a very common cause of heart failure. There are a lot of people who have hearts which appear, when we look at the angiogram, the hearts appear to pump very well. They're strong in pumping, but they're not good in relaxing. Just think of it like you're breathing. When you take a breath in, you breathe in and breathe out. Breathe in and breathe out. The heart does the same thing when it fills up and then expels the blood, fills up and then expels the blood. But what happens with this stiffened heart muscle, it's like having a straitjacket on. You can breathe out well, but you can't breathe in. And so that's the problem with this diastolic dysfunction or the stiff heart muscle, is the heart cannot relax well enough to accept the blood into it so that it can pump well. And this is most commonly caused by high blood pressure. Just like a weightlifter. If you look at a weightlifter before he starts to train, he looks like me, not very strong. After years and years of training, pumping that iron, the muscles build up on the weightlifter, they become thick. Same thing happens in the heart. If the heart pumps up against a normal blood pressure, the heart is not under so much stress and the muscle does not become thickened. If the heart has to pump against a high blood pressure, minute after minute, hour after hour, decade after decade, the heart muscle can become thickened and stiff. So you can think of what kind of heart muscle would you want for your heart? Would you want an athlete who has to run a long distance race? Would you want an athlete like a weightlifter? Or would you want an athlete like a long distance runner, thin, with lots of endurance? And what we would want is an athlete with long endurance, not the stiff, thickened athlete like a weightlifter. So the way we can confirm the diagnosis is with what's called an echocardiogram. An echocardiogram uses ultrasound waves. We put a transducer on the heart. This is the same technology that we use to look at the babies in the pregnant women. But instead we use it looking at and bouncing sound waves off of the heart. And that's called an echocardiogram. It's called echo because it's actually bouncing the sound waves off. And this is a picture of an echocardiogram. See if I can bring this up here. So this is an echocardiogram where the heart is pumping. The heart is pumping. And I'll show you a bit of what the chambers are here. This is where the blood comes back from the lungs into the upper chamber of the heart. Down here is the lower chamber of the heart. We call this the main pumping chamber of the heart. You can see it's the one which is really squeezing. And so the blood comes in through this valve and out through this other valve. And it goes out this valve to the rest of the body. So this is looking at the left side of the heart where the blood returns from the lungs, goes into the main pumping chamber of the heart, which is the left ventricle, and then is pumped out through the aortic valve into the rest of the body. So we can actually, with this kind of test, get a good look at how well the heart muscle contracts, how well it squeezes. And you can see from here, this heart is actually beating quite well, beating strongly. And we can also look at the thickness of the wall here. And so by that we can see how stiff the heart muscle is. We can also look at, using special techniques, very much like a police officer's radar gun, to look at the velocity of the blood flowing in. We can look at how quickly the blood flows into the main pumping chamber through this valve. You can see this valve opening up and closing. It's just opening and closing with each beat of the heart, and that keeps the blood flowing in the right direction. We can actually look at using this special Doppler technology to measure the inflow of blood into the heart and get various measures of how stiff that heart muscle is. And that can give us an idea as far as whether somebody's symptoms are due to heart failure from the thick heart muscle, that so-called diastolic dysfunction. Now, the third leading cause of heart failure are leaky or narrowed valves. In that echocardiogram that I showed you in the last slide, there were two valves on that left side of the heart. There was an inlet valve and an outlet valve. And these valves can either work normally or they can run into trouble. And they can run into trouble either by being leaky or narrowed, or sometimes both. Sometimes you have a mixed disorder where you have some leakage and some narrowing. Now, this is usually caused by age and calcification. As we get older, the internal tissues get thickened, there's some calcium deposits, and then the valves just don't open up well enough, or they don't close well enough and can cause some leakage. Now, the way leaky valves give the heart trouble is that if a valve is leaky, the heart pumps the blood out, but then some of that blood leaks back in. So the heart pumps the blood out, and part of it leaks back in. So 2 steps forward, 1 step backward. With that, in order to keep a steady, good, adequate flow out to the rest of the body, the heart has to work harder to pump that extra blood, the part that's leaked back. So the heart is constantly overworked, and then it does not function as well. So that is caused by a leaky valve. A narrowed valve limits the amount of blood that the heart can pump. Now, normally the size of the valve that the heart pumps through, that outlet valve, is about 1 inch in diameter, When that valve starts to get narrowed, it can be as narrowed as a soda straw. So you can see that if that valve has become narrowed, it's very hard for the heart to pump enough blood flow out to the rest of the body to nourish the tissues. And that is another cause of heart failure. You can imagine if somebody gave you that soda straw and had you breathe in and out of it. You might be able to breathe enough if you were just sitting real still and not having to do anything. But if you had to walk around the room with that soda straw breathing in and out, you would not be able to do that. You'd quickly find that you couldn't do it. Same thing with the heart. With a narrowed valve, the heart may be able to do its job at rest. But when increased demands are placed upon the heart to pump more through a narrowed valve, it just does not do the job. The symptoms of heart failure are fatigue, shortness of breath, and leg swelling. These are the most common symptoms. And that leg swelling, the medical term is called edema. Edema refers to excess fluid in the tissues. So we'll go over a bit of why the fatigue occurs. The fatigue happens because the heart can't pump enough oxygen-rich blood to the tissues. The tissues need the oxygen and the nutrients to do their job. Muscle, if you're going to be walking up the street, the muscles need oxygen and glucose and fatty acids in order to do their job. If the heart is not able to pump as much, you're not going to be able to walk as far or as fast, and that manifests as fatigue. Literally, the tissues run out of gas, and the gas that they're running out of is the oxygen. It's that gas of oxygen. The tissues are not getting nourished with enough tissue, and that's the reason fatigue occurs, is not enough blood flow with oxygen-rich blood is being delivered to the tissues. The second main symptom of congestive heart failure is shortness of breath. And this happens when the heart cannot pump enough blood out of the lungs. Remember, that was the first job of the heart, is to pump the blood through and out of the lungs. Well, when that happens, when it can't pump it out of the lungs, when the fluid starts to back up into the lungs fill with fluid. And then when the fluid is where the air should be, you can't get the oxygen into the bloodstream. And when the oxygen can't get into the bloodstream, you get that feeling of shortness of breath. Also, when the lungs are wet, when they're filled with fluid, it's harder to breathe, just to move the air in and out, and you get this symptom of breathlessness. This most commonly happens with exertion or when you're laying flat in bed. With exertion, more demand is placed on the heart. The heart's trying to pump the blood out of the lungs, and it's just not getting enough blood out of the lungs, and the lungs fill up with fluid while you're walking. While you're flat in bed, because the water can flow downhill, the lungs can fill up with fluid, and you can wake up with shortness of breath or have shortness of breath when you lie flat. The third main symptom of heart failure is that of leg swelling or edema. And this happens because the heart is not pumping enough blood to the kidneys. Now, the kidneys are very important with respect to heart failure, because the kidneys are the organ which decides how much fluid to get rid of and how much fluid to hang on to. And one of the things that the kidneys look at is to see how much blood is coming to them. If they're getting lots of blood, if they're being supplied well, they're happy. If the amount of blood which is being pumped to the kidneys starts being reduced, then the kidneys say, hey, something's wrong here. I think the body I'm in is dehydrated, and it wants to hold on to both salt and water. And this is one of the actual vicious cycles that the body can get into with somebody with heart failure, is that when the kidneys start to hang on to too much fluid and water and salt, it can cause the heart failure to become worse, which then causes the kidneys to even hang on to more salt and water. Now, this salt water stays in the body. It initially is in the circulation, but then it seeps out into the tissues of the body. And when it seeps out into the tissue, you get the edema. The edema is the swelling. When you press on the skin firmly for a few seconds, you can actually make a dent in that skin where you've kind of pushed the salt water aside, and then after a few minutes that dent fills back in again with fluid. So the reason it occurs in the legs, the edema occurs in the legs, is because water flows downhill. And where are our feet most often? Furthest down. So the water flows down into the legs, and that's why you get the fluid buildup there. This can also happen when lying flat in bed. As I said, the fluid can fill up in the lungs as well. Now, here are some of the tests that we as doctors use to diagnose heart failure. The first, and perhaps most important, is the patient's history and physical exam. We ask the patient how they're doing, the symptoms, how far they can walk, under what circumstances they run into trouble, how often do they have swelling in their legs. Those are some of the symptoms that we try to elicit from the patient in determining whether they have heart failure. The other things we look at on examination is we check the blood pressure, a very important thing, because if the blood pressure is always high, we know that heart has been overloaded. We listen to the heart. We listen for murmurs. We listen for the regularity of the heart. We listen for abnormal sounds, which would indicate that the heart is not functioning at 100% capacity. We listen to the lungs. And one of the things we're listening for is fluid in the lungs. And we actually hear that as little crackles in the lungs. You take a sponge, your ordinary kitchen sponge, when it's dry, you get it from the hardware store and it's dry, and you squeeze it in your hand and you let it open, you don't hear much because it's opening and closing. You're squeezing the air out and then letting it expand with air. And you let that sponge get a little bit damp, squeeze it, and then listen to it. You'll hear little tiny crackles throughout that sponge as it tries to expand with a little bit of water in it. Same thing as what we hear when we listen to the lungs as physicians. We listen for that fluid in the lungs. And then we also look at fluid in the legs. An electrocardiogram, an EKG, is another very important diagnostic test in looking at heart failure because it can tell us about heart rhythms. It can give us some clue as to whether the heart has become enlarged or the muscle is thickened. It can tell us if there is damage to the heart. It can give us a hint that there's been a prior heart attack. A chest X-ray tells us whether the heart is of normal size. And it also gives us a picture of the lungs. We can look at an X-ray and see whether the lungs are full of fluid or whether the lungs are clear. There are certain blood tests that we can do which can give us suggestions as far as why somebody might have heart failure. The echocardiogram, the picture I showed you before, which showed the contraction of the heart, the beating heart, is a very important test in looking at heart failure because it can tell us the size of the heart, the strength of the heart muscle, and if that heart muscle has been damaged in one or more areas. And the angiogram is another important test that we can do to look at the arteries. Those are the pictures that I showed you where the catheter was injecting the contrast into the arteries. And that can tell us if there are blockages in the arteries. That's a very effective test. I'm going to briefly go over some of the medications for heart failure. There are many, but the three main categories are diuretics, beta blockers, and the overall classification of ACEs, ARBs, and vasodilators. So diuretics are what we know as water pills. And they are there to help rid the body of that excess salt and water. As I said before, when heart failure occurs, one of the first things that happens is the body starts holding on to more salt and water. So in order to counteract that physiologic response, we use the water pills to help get rid of that salt and water. One of the most important things that you can do to keep heart failure under control is to not overload the body with salt. When you do that, if you're taking in too much salt, the heart gets overloaded, and we have to give the patient more diuretics. The second classification of medications are beta blockers. Beta blockers are medications which have been around for many, many decades. When I went to medical school, we thought beta blockers were actually harmful in heart failure. Now, in the past 20, 30 years, we've learned that beta blockers actually can make the heart beat stronger. And so beta blockers are an essential component of treating heart failure. And anybody with heart failure should be on it unless there are strong reasons not to use that. The third classification are what we call ACE inhibitors, ARBs, and vasodilators. These help the heart by making it easier for the heart to pump blood out to the rest of the body. They do this by lowering blood pressure and opening up the blood vessels so that the rest of the body is more receptive to the blood which is being pumped from the heart. So those are the three main medications used for treating heart failure, and there are many, many brand names and generic names within that category. There are some other medications which can be used, but these are the main ones. Now, let's talk a bit about diet and lifestyle. If there's one message I want you to take home from today, what is it? Right. I don't think I could find a bigger font for my slide. Salt is the enemy in heart failure. Next time I give this talk, I'm going to have little stickers printed up with a skull and crossbones that you can put on your salt shakers. Because salt is the dangerous thing. It's also important to avoid foods which are high in sodium. Almost anything you'd find in a deli, luncheon meats, ham, cheese, pickles, relish, anything that's preserved is going to be loaded with salt. If you are a patient who has heart failure or high blood pressure, you should have a rule that nothing goes into your shopping cart without first looking at the sodium content. Because then you'll learn which foods are high in sodium, which foods are low in sodium, and over time you'll gravitate to a low sodium diet, which will give you a longer, better life. Another important part of lifestyle and diet in heart failure is to limit the fluids. As I said, the body often hangs on to fluids, and so we don't want to overload it. And so with the consultation with your physician, you may want to limit the amount of fluids that you get. And finally, with a lifestyle is regular exercise. With heart failure, the heart is only able to do so much. What you want to do with exercise is to optimize the rest of the body so that it works well, so you can do more with whatever the heart is able to pump. It's just like keeping the machine in good condition. If you have a car and the bearings are not rolling well and the oil hasn't been changed and everything is kind of run down, if the engine is a bit impaired, the car's not going to be able to go well. But you lubricate that car, tune everything up with exercise, even with that impaired engine, the car is going to be able to do more. Same thing applies to people with heart failure. Let's talk a brief amount before going to questions and answers about controlling your own heart failure. If you're a patient who's been diagnosed with heart failure, it's important that you watch your diet and avoid salt and sodium. Critical factors there. Limit your fluid intake. Very important that you take your medications as prescribed. We as cardiologists like to think of ourselves as making all these fine adjustments in the medications to optimize things. That really counts on you following the instructions so that when we make an adjustment, we can see the beneficial effects in you. If you're not taking your medications regularly, it's going to make the heart, it'll make treatment of the heart disease more difficult on your physician, and you won't get as much benefit. Getting regular exercise is very important in controlling heart failure. It also allows you to monitor your symptoms. If you have a regular walk and you've been doing it for the past year and a half, and all of a sudden you find that you're not able to do that regular walk, or you're only able to walk that walk in more time, it takes you longer to do the walk, or you can't complete the whole walk, that tells you something's going on. Something's going wrong. Get in to see your doctor. That is a way to monitor your symptoms. Another very important thing is to check your weight daily. By checking your weight, you're looking to see whether you are retaining that salt and sodium. And if you see your weight climbing up, if it climbs up over 3 pounds above your baseline, get in with your doc. Talk with them. You may need more diuretics. You certainly need to watch your salt intake. And the important thing is to monitor and then call your doc if you're getting off track. Now, if you have heart failure, here are the things which would cause you to seek medical attention promptly. One is worsening leg swelling or weight gain. Second is shortness of breath with exertion beyond what you're used to. A third would be unexplained fatigue. If you're having new symptoms of fatigue that you didn't have 2 or 3 weeks ago, that would be another symptom to cause you to see your doctor. If you're waking up with shortness of breath, that's a sign that there's too much fluid in the lungs and you need adjustment of your medications. If you're having dizziness or lightheadedness, chest pain or palpitations, those are things which should cause you to come see your doctor. Now finally, I always like to talk about prevention because prevention is the key. Because we want to prevent heart failure rather than have to treat it. Most important in preventing heart failure is control your blood pressure. Keep your blood pressure in a good range. If you have diabetes, keep it under good control. Know your A1C. Control your cholesterol because that helps to prevent the blockages from building up in your arteries. Very important, if you're having symptoms of chest pain, don't ignore a heart attack. Come into the hospital, get treated, get that artery open so that we can prevent the damage to the heart muscle. An obvious thing, don't smoke. Keep your weight at the best weight for you. avoid salt and high sodium foods, get your regular exercise, limit alcohol, and monitor your symptoms. So in summary, heart failure is when the heart is simply not doing its job well enough. Heart attacks and high blood pressure are the leading causes of heart failure. It's important that you know the symptoms of heart failure: the shortness of breath, the fatigue, the leg swelling, and edema. Taking your medications properly and avoiding salt and high sodium foods are key to preventing heart failure. And finally, now that you've learned something here, I want you to go out and educate and teach your family and friends to help keep them alive and healthy. Thank you. Ready for questions? Okay.
When you say to limit your fluid intake, we've been learning to take 6 to 8 glasses of water a day. Is that too much or too little?
If you have heart failure and your doctor has told you to limit your fluid, generally it's about 2 quarts of fluid a day, sometimes less, but 2 quarts of fluid a day. The notion that we need to drink 6 or 8 glasses of water a day is pretty much bogus. We don't need to drink that much water. Our kidneys, and if our body functions are working well, we don't need to take that much fluid in. The only reason to do that would be if you have kidney stones, where you want to have dilute urine and avoid kidney stones. But 6 or 8 glasses of water is not necessary.
With the water intake, I was told I could only have, it's about 5 cups of water a day. Mm-hmm. That's only 1 liter. And with that, does that count if you have tea, milk, or juice?
Yes.
Well, I don't have juice, I have fresh fruit, but you have to count that as well?
Yeah, what you're wanting to do is
You just get a little bit of water, which I've been doing, for your pills. That's what I'm.
Right, because there's water in other forms of food. If you have fresh fruit, that has a lot of water in it. So you really have to look at how much water is in the food versus how much water is in the drinks, the tea, the coffee, or whatever else you might be having.
First of all, thank you very much for this informative workshop. I learned a lot from this tremendously. You talked about the leaky valve for the heart. Does a pacemaker help with that in terms of pumping the heart evenly or better for the body to work? No,
a pacemaker basically is something to keep the heart beating at least a certain rate. There are certain conditions which affect heart rhythm, and I believe Dr. Reddy may be addressing some of these in the next talk, where the heart would beat too slowly. So a pacemaker keeps the heart beating at a certain rate. And pacemakers have been around for a long time. They're more sophisticated. What we know about ourselves is when we're resting, our heart rate is relatively slow, maybe 60 beats a minute. As we exercise, the heart beats faster, because the heart is being called on to pump more blood. And so there are smarter, newer, better pacemakers which can actually sense the motion or activity of the body, so that when you're exercising, the pacemaker starts to make that heart beat faster if your own rhythm generating mechanism is not working well. So a pacemaker works for the heart rhythm. It does not help leaky valves and generally does not help congestive heart failure. There are some very new, sophisticated techniques which I don't know if Dr. Reddy will be talking about.
Another question that I have is, when you retain water and you lose water, is there any kind of nutrients that you lose when you take the diuretics?
Often you lose potassium. So one of the things that you may be prescribed if you're on diuretics, you'll be prescribed some potassium pills or to take more potassium-rich foods, or you may be prescribed a combination of a diuretic along with what's called a potassium-sparing diuretic. These are a special class of diuretics which tell the body to hang on to some of the potassium as it's trying to get rid of the sodium.
For the people with low blood pressures, then they don't have to worry about heart attack. Am I right?
No, everybody has to worry about heart attacks because heart attacks are probably the most common cause of death here in the United States. Heart disease is really, really common. Now, if you have low blood pressure and have had it for many years, that's a wonderful thing because having high blood pressure creates excess wear and tear on the arteries. So the fact that you have low blood pressure would be a good thing and make it less likely that you would build up blockages in the arteries or suffer a heart attack. But it by no means excludes you from cholesterol buildup or other things which may lead to plaque in the arteries which can lead to heart attack. But overall, lower blood pressure is better for everybody, especially for patients with heart failure.
Like the people with the diastolic pressure, 60, 65 or something like that.
Though that is usually quite adequate to maintain good function. The time we worry about blood pressure when it gets so low that it causes us to be dizzy or lightheaded. The thing you have to remember is that the heart is constantly pumping the blood up against that blood pressure. The higher the blood pressure, the harder the heart has to work, and the more likely it's going to get into trouble. The lower the blood pressure, as long as the blood pressure is not so low it causes you to feel dizzy or pass out, the easier it is for the heart to do its job.
Yeah, I have a low ejection fraction of like 15%, and I got an ICD put in, and I was jogging a lot, and I recently quit, and I'm wondering if, I know the ICD doesn't stop every, like arrhythmia.
And one of the
I
things
feel better when I exercise, what I'm saying. Does the ICD keep it like my heart at a normal rate while I'm exercising?
there are many different types of ICDs, and I would advise you to consult with your physician about the specific type of ICD it's setting and how it's going to work with you as you exercise. For the audience out there, an ICD is an implantable cardiodefibrillator. It is a device which shocks the heart. One thing I did not talk about in my lecture was that as heart function becomes very low, the heart has a greater tendency to develop rhythm disturbances which can be fatal, which can be very serious. A defibrillator is a device which is planted usually under the left clavicle, left collarbone, which is used to shock the heart should one of these rhythm disturbances can occur. Our past vice president, Dick Cheney, had one of these installed because he's a guy who had very severe heart disease for many years. And so he had his defibrillator implanted. He called it his Pacemaker Plus. But it's there to help correct a serious abnormality with the heart rhythm while it occurs. Newer defibrillators have all kinds of other capabilities built in, and that's a topic for another talk.
You have a slide on shortness or symptoms of health failure, which is fatigue, shortness of breath, and leg swelling. Can that be caused by imbalance of medications that a patient's taking?
Certainly, many symptoms can be caused by a maladjustment of medications. That's why if you do have heart failure, regular consultation with your physician is very important so you learn what the beneficial effects of the medications are, what the side effects are, and how to respond to any symptoms that might occur. With any medication, such as a diuretic, you can be at the right amount, or you can be over-diuresing a patient. If you take too much fluid out of the body of a patient with heart failure, they're going to feel very weak. If you don't give them enough diuretic, they'll start to have more symptoms of fluid overload, the shortness of breath and edema. So it is all this balance and adjustment, the fine-tuning that the cardiologist can do to help optimize treatment of heart failure.
Dr. Nicholson, if a person has leaky valves, what concern or symptoms he should be watching out for?
Well, oftentimes leaky valves show no symptoms at all. Because if the leakage is not very much, the heart really doesn't have to do that much extra work to compensate for that leaky valve. In fact, if you use very sensitive equipment to look at everybody's valves, almost everybody will have some detectable leakage of the valve. So leakage in the valve becomes a problem only when the amount of leakage gets to a point where it is really truly causing some dysfunction of the heart, where the heart is not able to do its job well. And you will have the symptoms that I described: the fatigue, the leg swelling, or shortness of breath. If it's a narrowed valve, you can get episodes of dizziness. So there are different ways in which the valve problems of the heart can manifest itself as symptoms. I would encourage you, if you're having symptoms or you want to learn what's most likely to affect you given your certain heart condition, consult your doc, and they'll be able to tell you what to watch out for.
Well, let's thank Dr. Nicholson.